United States is in the midst of an alarming health crisis. Health disparities among some groups, when compared to the majority population, are staggering when considering overall health and health care. The Health Resources and Services Administration defined health disparities as population-specific differences in the presence of disease, health outcomes, or access to health care within the African American, Hispanic, Latino, and Appalachian communities. Every day, thousands of minorities either become sick or die from cancer, HIV/AIDS, cardiovascular disease, stroke, and diabetes. When confronted with the statistics comparing the prevalence of major health issues and resulting death rates between minority and majority populations, former City of Cincinnati Mayor Dwight Tillery found the numbers staggering. The data, in combination with a passion that resulted from his own realization of how many people in his life had been affected by major health issues, including his father who passed away at age 60 from prostate cancer, Dwight created the Center for Closing the Health Gap in Greater Cincinnati. The Center for Closing the Health Gap in Greater Cincinnati was formed to address the issue of racial and ethnic health disparities as a community-based nonprofit organization. The center's sole mission is to eliminate health disparities in minority populations through advocacy, education, and community outreach in Greater Cincinnati, Northern Kentucky, and Southeastern Indiana. The Center for Closing the Health Gap in Greater Cincinnati's goals are to increase awareness of the existence of health disparities, to maximize collaborative opportunities to improve minority health by working with organizations, associations, health institutions, business, and other community stakeholders, and to develop a research network to collect and distribute local data on health disparities. A key component to achieving these goals is community-based participatory research, CBPR. This grassroots method brings research to the community for development, so residents have the ability to engage in a process to determine what programs are needed to combat health disparities in their neighborhood. As a community grassroots organization, the Center is developing strategies to equip and empower people with the information and tools to change their health outcomes. The Center is staffed by health professionals, including research directors and community health coordinators. The board of directors is comprised of health executives, medical professionals, and community leaders. To further attack the issue of health disparities, the Center has formed partnerships with all the major hospital organizations in Greater Cincinnati. In addition, the hospitals provide funding for programs, initiatives, and research projects. African Americans, Hispanic Latinos, and Appalachians are in a health crisis. The Center for Closing the Health Gap is taking the lead in bringing the issue and solutions about health disparities to the Greater Cincinnati region. The community must be mobilized toward strategic action and a unified approach to eliminating health disparities. The key to accomplishing this is through a collaborative effort among health providers, community-based organizations, and the businesses. With an increasingly diverse population, the health of this region, and ultimately the nation, depends upon the ability to make minority populations healthier. Racial and ethnic minority populations are expected to reach almost 50% of the nation's total population by 2050. Businesses will bear the financial burden of lost productivity and healthcare costs associated with health disparities. The impact of health disparities on employers include increases in direct costs for health expenditures, lower and lost productivity, increases in absenteeism, increases in cost for hiring and training new staff, and disability benefits. To be productive, employees must be healthy. Your business's participation matters, and your support of the Center for Closing the Health Gap's efforts to eliminate racial and ethnic health disparities in Greater Cincinnati are important. These efforts will prove to our combined consumers that Greater Cincinnati businesses do care and are working together to make an extraordinary impact on this critical issue. The Center for Closing the Health Gap in Greater Cincinnati's vision is a healthier region for all. There's a shortage of information on health disparities and how to combat them that is readily available to the broader populations of African Americans, Hispanics, and Appalachians. By collaborating with a variety of professional sectors and disciplines, local organizations, and governmental agencies, the Center for Closing the Health Gap is identifying and implementing regional programming solutions to effectively minimize and eventually eradicate this complex health problem. To achieve these goals, the Center for Closing the Health Gap develops and implements many initiatives for eliminating health disparities. Among them, an annual health expo that attracts thousands of attendees, regional conferences, and the Health Leadership Institute for faith-based organizations that instructs churches and similar organizations to promote healthy, active lifestyles through health ministries. The Do Right campaign is a grassroots community-based program empowering and guiding leaders within local communities on how to eliminate health disparities in their own backyard. In addition to these core programs, the Center offers program development and evaluation, report writing, focus group conduct and summary, literature review, cultural competence training, and web-based survey design and data collection services in its mission to eliminate health disparities. Through these collaborative initiatives, the Center for Closing the Health Gap in Greater Cincinnati is raising awareness of this health epidemic and ultimately motivating the at-risk populations to take responsibility for their health. This can be accomplished through proactive rather than reactionary measures. An integral program of the Center is the Health Leadership Institute, or HLI, for faith-based organizations. The purpose of HLI is to train and assist faith-based organizations to promote healthy, active lifestyles through health ministries. The goal of the program is to help religious organizations develop health ministries and improve existing ones to build strong and healthy congregations and communities. Participants are required to attend a series of 6 evening classes taught by public health leaders, healthcare providers, and experts in health ministry development. Class topics include the health status of African Americans, creating effective health ministries, improving individual and community health, understanding the local healthcare system and funding health ministry programs, developing and evaluating health ministry programs. A graduation ceremony is held at the conclusion of each class series. Between 2005 and 2008, 87 churches have graduated 178 people from the program and gone on to implement the principles they learned within their congregations. The HLI program is funded through a grant and continued support from the Anthem Foundation. The success of the HLI project led to the pilot of the HLI Do Right Challenge. The challenge involved 5 graduate churches of the HLI program who competed to see which team could help improve their health status. In partnership with Tri-Health and Mercy Health Partners, the 5-month program took health screenings and education to local churches in a fun and motivational way by combining health assessments and instruction with friendly competition. Participants committed to active participation in health monitoring and improvement activities that were taught in weekly fitness and nutrition class sessions. The goal was to improve biometrics such as cholesterol, blood pressure, and blood sugar. A major incentive motivating teams during the pilot was a $10,000 prize provided by Tri-Health. The prize money was shared between the participating churches and goes toward improving the church health ministry. The church with the most improved health status received the largest percentage of the winnings. Excellent results have been achieved through the challenge. 95% of the group now incorporate healthy lifestyle changes into their daily routine. Participants as a whole lowered their blood pressure and blood sugar numbers. In addition, they lost almost 500 pounds and 183 inches. The center expects the next round of the challenge to grow and have even more life-changing results. Currently, and for the next few years, the Center for Closing the Health Gap's primary focus is raising awareness on and combating the issue of obesity. Obesity is rapidly closing in on smoking as the nation's #1 underlying preventable killer. It is a major modifiable factor for heart disease, and it increases the potential for high cholesterol, high blood pressure, type 2 diabetes, and other serious health conditions. And although obesity threatens everyone, minorities are significantly more at risk. Nationally, 63% of African American males and 77% of African American females are overweight or obese. In Greater Cincinnati, almost 4 in 10 African Americans were obese, 39%, compared to 27% of all adults in the region. Even more alarming, in Hamilton County, 39.8% of Black non-Hispanic Latino children are overweight or obese, compared to 26.8% of white non-Hispanic Latino children. Due to these statistics, the center launched a campaign with the support of the city of Cincinnati titled Do Right. The goal of the campaign is to increase awareness on the alarming impact childhood obesity is having on African Americans, Hispanic Latinos, and Appalachians. Provocative outdoor billboard and bus shelter ads contain messaging that focused on the New England Journal of Medicine declaration that this could be the first generation of kids to not outlive their parents. Through the Do Rights programs, communities are empowered with the tools to improve nutrition and increase physical activity, to do the right things to improve health and reduce the negative impacts of obesity. It further encourages individuals to eat right, move right, and live right. It stresses the importance of making better food choices by promoting healthy eating and becoming more active through physical activity. Do Right also addresses cultural and language differences, family and community considerations, and the built physical environment. With the use of community advocacy activities, the campaign is focused on making environmental and policy changes to increase access to healthy foods and opportunities for physical activities. Programming components of the Do Right campaign include Neighborhood assessments. Assessments of targeted neighborhoods to learn about knowledge, attitudes, beliefs, behaviors, and environmental factors impacting obesity. The information generated from these assessments will guide the future development of strategies and programs specific to improving physical activity and nutrition within each neighborhood. Community education workshops. One-time or educational series workshops taught by trained healthcare professionals on the following topics: recognition of risk, eating right, understanding food labels, portion sizes, and healthy cooking techniques, and moving right, adding physical activity into daily life. Fitness demonstrations such as traditional and alternative forms of exercise like line dancing, salsa dancing, and Tai Chi are used to demonstrate how to move right. Other Do Right programs include the Children's Community Garden Initiative and the Do Right Kids program. The Children's Community Garden offers hands-on gardening, nutrition education, healthy food preparation, and environmental lessons for children and teens. The students are given a fitness and nutrition lesson twice a week before tending the gardens, which grow a variety of vegetables and produce. The Do Right Kids program is to improve health status and well-being through involvement in physical activity and nutrition programming. Parents are also encouraged to participate in sessions on healthy eating and the importance of daily physical activity. The Center has dedicated a website, DoRightCincy.org, to this campaign and all of its programming components. On this site, you will find facts and statistics on the obesity crisis and tools that provide information on how to eat right, move right, and live right. The Center for Closing the Health Gap's many health programming initiatives promote community involvement and ownership of health problems and solutions using a variety of approaches. The premier event of the Center for Closing the Health Gap is the annual Health Expo, which provides education and resources, health screenings, fitness and cooking demonstrations, national speakers, and musical performances. Between 2005 and 2008, over 14,500 people were served by the Health Expos. The results of a survey taken by 2008 Health Expo participants were as follows. With the increased exposure and availability to educational information, participants learned how to become more fit and active, establish better eating habits, and become more involved in raising health awareness among family members. Identification of high risks were made available to participants by on-site results procedures. Analysis of screenings indicated there were severe health issues present in the participant population, including but not limited to diabetes, high cholesterol, heart disease, cancer, and high blood pressure. 55% of those surveyed strongly indicated positive reaction to the overall expo by rating it as excellent on a 1 to 5 scale. More than half of the participants were repeat attendees from previous year's expos. And there was high attendance from both African American and Appalachian target populations. For future expos, the Center for Closing the Health Gap is focusing on increasing attendance across target populations and participation of vendors and sponsors. The Center for Closing the Health Gap invites all companies, no matter the industry, to participate in and sponsor the largest health expo in the region. The Center for Closing the Health Gap in Greater Cincinnati continues to make strides in the fight to eliminate health disparities. Through a variety of services, the center is having a positive impact on the communities it serves. There are several opportunities to work with the center by volunteering, by becoming a community partner, or by participating in our internship program. Please join with the center and get involved in your community. Raise your community's awareness, advocacy for, and education on how the ethnic health gap can be eliminated. Log on to closingthehealthgap.org or call 513-585-9872 for volunteer opportunities.